What's up guys, welcome to another week's episode of GetPsyched. Now today we've got a bit of a special video because this was actually suggested by one of our viewers. And this is about the link between physical health or physical wellness and mental health. If you guys have a suggestion for GetPsyched or a video that you'd like to see, make sure to comment on this video here. You can get in touch with me on social media as well and we might just run it. I really like this topic. I thought there's a lot of meat in this, and it would be good to kind of have a bit of a condensed understanding of the connection between physical health and mental health. So let's get into the video. You know, it's really easy to think that in some way the mind and the body are different. But in truth, the research time and time again speaks to a correlation between physical health and mental health. If we have good physical health, the likelihood is we're going to have good mental health as well. Likewise, if we have poor mental health, it's possible that there's going to be a correlation there that we also have poor physical health. This connection kind of goes both ways, and one in each other kind of bounce off the other. And it's important to kind of address that if we've got poor mental health, we need to assess our levels of physical health. And again, if we've got poor mental health, actually addressing our physical health might have really positive ramifications for our mental well-being. And the statistics are clear and actually are really, really scary. People that recorded a higher level of distress or lower mood were statistically 32% more likely to experience cancer in their lifetime. Depression is also correlated to other chronic physical health disorders such as heart disease. 22% of people that were diagnosed with a severe form of heart disease reported that they had really severe depression. So we can start to see that actually, depression and mental health might just have a real powerful connection to our physical well-being as well. It's been reported that people with chronic diseases of some kind are 3 times more likely to experience a mental health disorder. And 45% of people diagnosed with a chronic disease, a chronic physical disease, reported that they have been experiencing severe depression at some point in their lives. So once again, we can see this connection. Our physical health is connected in some way or another to our mental health, and our mental health is connected to our physical health. So the first question that we kind of have to ask on the back of those statistics, and the one that I asked when I first saw these statistics as well, is does poor mental health cause things like cancer? That seems like a really scary prospect. It seems like a really scary question to ask as well. The truth is that it's probably not the case that mental health difficulties thus lead to cancer, or depression equals cancer, so to speak. But there are some connections that need to be made. For example, people that have depression or people that have difficulties with their mental health are less likely to access medical services, they're less likely to access diagnosis, and therefore can receive more complications when it comes to their physical well-being. Now that's still a correlation there. When we've got poor mental health, we're less likely to actually access the services that might help with our physical health, and as a result, our physical health starts to deteriorate. So that's the kind of causal link that we're talking about here. So there's something to be said about the individual and the role and responsibilities that they have. There's also something to be said about the roles and responsibilities that medical services themselves have. So when people present with chronic health disorders, or it's speculated that they may have some kind of physical illness, that will take precedence over the mental health complications that might be there. Not always, and I'm not necessarily criticizing GPs or doctors for that as such. That does make sense to some degree. They're just working within their competencies and their capabilities. And at the moment, that chronic health disorder seems to be more prevalent and more important than any other mental health issue going on. So there's something here to be said that people that are presenting to services or medical services with chronic diseases such as heart disease or cancer, that's going to take more of a focus from the medical staff or the medical teams involved than any underlying mental health complication. And as a result, those mental health difficulties that are underlying just don't get treated, whilst the chronic diseases do get treated. So there's something here about the fact that, we can start to see a little bit more of a causal link between those that suffer from physical illnesses and actually those that suffer from mental illnesses as well. When we think about the responsibility of the individual, or the things that the person can do that might help their physical health and as a result improve their mental health, we have to think of things like exercise. Reports show time and time again that simply just 10 minutes of exercise is enough to release endorphins, a chemical in the brain that assists in developing our mood. And if we allow our brain to be exposed routinely to those endorphins, as a result, over the longer term, the theory goes that our mental health will improve. So if we take steps to improve our physical health through things like exercise, it's going to result in improvements in our mental well-being overall. Physical exercise does things like it reduces weight, it improves sleep, it improves our diet even. All these kind of things that are correlated, the research shows, to overall senses of mental well-being. So once again, we can see that there is this connection between physical well-being and mental well-being. The same can also be said for diet in itself. Diet has a real positive impact on our physical health, on our our ability to be diagnosed with diseases, for example. If we have a positive and good diet, it's less likely that we're going to be diagnosed with a physical health condition. If we have a balanced meal of proteins, essential fats, complex carbs, low sugars, low alcohol, these are the kind of things that are going to have really positive implications for our physical health, but they also have a direct correlation to mental health. So if we're thinking about this connection, it's important to be considering exercise, and it's important to be considering our diet as well. Smoking is another thing that should be taken on as a responsibility from the individual. People that have depression are twice as likely to smoke, and people that have schizophrenia are 3 times as likely to smoke. Now, the issue with smoking is that initial cigarette or smoking in the moment gives us that hit of dopamine, but over the long term, smoking actually reduces the brain's ability to create dopamine. So we're getting an initial hit in the moment, but as time progresses, our brain is less likely to release those chemicals and those endorphins that actually can elevate mood. So once again, over the long term, if we're smoking over a prolonged period of time, our mental health difficulties are probably going to get worse. That also correlated to the fact that people that have long-standing mental health difficulties are more likely to smoke, shows once again that there's a really complex correlation to the things that we do physically and the impact that it has on our mental well-being. One of the things I want to say here is that yes, there's a connection between what we do physically and the impact that it's going to have on our mental well-being, but it's not always as straightforward a correlation as that. Things like smoking, for example, it's clear that there is some kind of connection between if we have a poor state of mental health, we're inevitably going to be doing things to some degree that impact negatively on our physical health. For example, somebody who may have agoraphobia has a real severe anxiety and social phobia of the outside world. That person is more likely going to stay inside. They're less likely to be eating healthier. They're less likely to be conducting exercise. So it's really hard to say what came first, the chicken or the egg here. Do we have to address physical health issues in order to see improvements in our mental health? Or do we have to address mental health difficulties in order to improve physical health? What I would say here is that these things are absolutely subjective. If there's an individual who started to experience really low mood and they're not exercising, they're drinking every night, they're going out with their friends and having takeaways, those kind of addressing those physical or those exercise and those dietary issues that have a real positive impact on our physical well-being should probably be considered first in order to see improvements in mental well-being. However, if we have a client or an individual who has schizophrenia and is more likely to smoke as the statistics show, or if we have somebody who is agoraphobic and is less likely to be going outside and conducting exercise, then we need to be addressing those mental health difficulties first in order to see changes in the physical well-being or the physical activities that are going to have even more of a positive impact on mental well-being. So again, it's very, very hard to know what comes first, the chicken or the egg. We have to look at the individual subjectively. And this is the case for things like psoriasis, which is an autoimmune condition and a skin condition. And it's reported that people that have psoriasis, 10% of them have had active suicidal thoughts in the past year. And 1/3 of people that are diagnosed with psoriasis have had severe depression since their diagnosis. This combined with the fact that only 4% of dermatology units have access to a therapist that they can refer people that have psoriasis to, shows that there really is not much of a correlation or an understanding of that correlation between the physical health and mental health. People with psoriasis clearly suffer to some great degrees with their mental well-being, yet the services to support them are not there. So again, psoriasis is an example of how a physical condition can lead to complications in mental health. Again, the correlation is there, but it can be complex to understand at times. Okay guys, thanks so much for watching this short video from GetPsyched on mental health connection with physical health. I think we could do a series on this. We could cover so many different points. If you think there are points that I've missed or that you would like to be considered to talk about, then make sure to comment and we can chat a little bit about them. Likewise guys, if you've got a suggestion for a GetPsyched video, make sure to get in touch and we'll definitely consider it. If you've enjoyed today's video guys, you're definitely going to enjoy this video on how to start to talk to children about mental health. And if you've enjoyed the video, make sure to hit the like button, you can comment and I'll get back to you. And if you've enjoyed GetPsyched as a whole, make sure to subscribe to us and you can hit that little bell next to the subscribe button and you'll get weekly reminders every time I upload. Thanks so much for watching guys and hopefully catch you next week.